Orofacial pain is always considered this mysterious field of dentistry that people don't quite understand. Some people think it is TMJ, some people think it is splints, and some people just think it is controversial. Most people don't even know, dentists included, that OFP is actually a CODA accredited specialty now, and it is recognized as the 12th dental specialty since 2020 November. So today I'm going to clear some of the confusion regarding OFP, and this is specifically going to be useful to young dentists, to students who are wondering if this is an avenue that they should pursue. So now first understand what orofacial pain or OFP is. So orofacial pain deals with pain in the head, neck, the mouth, jaws, and any related structures, usually above the shoulders. It also obviously involves the teeth, because as a dentist, you first need to make sure that the problem your patient is complaining of is not tooth related. So orofacial pain sits at the intersection of dentistry, neurology, psychology, pain management, sleep medicine, and musculoskeletal disorders. So you have to have a comprehensive, complex understanding of a number of conditions and a number of anatomical structures as well. So now what do we actually treat, or what conditions do we manage in orofacial pain? So of course we see TMJ disorders, but you have to understand that all OFP is not TMJ. So we do see TMJ disorders like disc displacements, arthritis in the joint, joint derangement, and so on and so forth. And of course some myalgia and myofascial pain. Then we see nerve disorders, so patients that have trigeminal neuralgia, burning mouth syndrome, post-trigeminal neuropathies, or just sometimes idiopathic trigeminal nerve pain. Then we see patients with sleep disorders like snoring, sleep apnea, upper airway resistance syndrome. And if you have a deeper understanding or a deeper interest in sleep medicine, you can, sort of expand your practice by studying a little bit more into, say, insomnia and other sleep-related disorders. And then we also solve for headaches. So patients that have migraines, tension-type headaches, because very often patients will come with overlapping pain. So, we see patients with TMJ pain and headaches come to us. So this is the broad purview of conditions that we see in orofacial pain. And now, why did this specialty really develop? So the specialty developed because, patients were often bounced around between different specialists like ENTs, dentists, neurologists, and, they very often didn't get any solution. So you would see a lot of, pointless procedures like tooth extractions, occlusions being repeated, occlusions being altered, and root canals being repeated. So, this sort of emerged from a need for a structured specialty, structured training to solve patients who have sort of complex and overlapping pain symptoms. So the idea and the key in orofacial pain is knowing when not to do dentistry and to understand that all pain does not live just in the teeth. Now, coming to how it started, as I said, it started because, of the need that patients had, and it began in a university-based setting. It actually began at my alma mater, that is UCLA, the University of California, Los Angeles, and it is my training, I think, at UCLA that has, made me the clinician that I am today. So yeah, basically a university-based setting allows you to really have exposure to all of these different fields of study that I earlier mentioned. Most programs are 2-year programs, and they encompass hospital rotations, medicine exposure, working closely with neurologists, with psychologists, so you get a very deep understanding. It cannot be culminated into weekend courses, which is unfortunately what we are seeing now. A 2-year learning or deep understanding of pain and its management cannot be condensed. You should always go for a university-based program, and that is evidence-based rather than standalone short courses which focus only on appliances or just on some techniques. Because orofacial pain is basically diagnosis. It is not procedures that you do, it is your diagnosis that really matters. And this is also where the CODA comes in. So CODA is the Commission of Dental Accreditation, and it certifies programs and dental schools in the US. So the accreditation by CODA in November 2020 has allowed for, it created accountability. It defined the scope of practice. It gave structure to the specialty, gave a standard of training, and the CODA has certified ABOP, that is the American Board of Orofacial Pain, to standardize the training of all orofacial pain patients. So ABOP not only gives out certifications after you pass a 2-part exam, but it also protects patients and makes sure that the clinicians that are treating patients with orofacial pain are, validated. The education is validated, and there is a basic level of science and training that they have undergone. So the basic level of education or educational qualification is met. That's what ABOP, basically ensures. Yeah, orofacial pain is a complex condition. If you're a young dentist who's wanting to pursue it, please do go ahead. It is, intellectually enriching. It is interesting. You can really make a difference in your patient's life. If you're a general dentist, you should know when to refer out, or, you should try and expand your knowledge and, provide your patient with the correct service. So yeah, so orofacial pain is not mysterious. It is very evidence-based. It is interdisciplinary. It is patient outcome centered. Let me know if this video helped you, and if you liked it, do subscribe, and do let me know what you would like me to talk about more when it comes to orofacial pain.